All right, let's kick off this deep dive and talk about rising healthcare costs and how all this ties into aging populations. People have been super curious about this lately, and well, we found some really interesting research to dig into. One article in particular from Frontiers in Public Health really got us thinking. The title's a mouthful, but it's called How Heavy is the Medical Expense Burden Among the Older Adults and What Are the Contributing Factors? A literature review and problem-based analysis. Ready to get started.
Definitely. And yeah, why don't we start with that global aging trend everyone's talking about? It's not just a Western thing anymore. It's a huge shift that's happening worldwide.
Okay, so just how big are we talking here? Give us a sense of the scale.
So think about this. Back in 2010, 71 countries were already considered aging societies, which means a large part of their population was over 60. And it's just getting bigger, way bigger. China's a good example. By 2050, they think over 30% of their population will be over 60.
Whoa, 30%. That's a lot of people. I mean, I knew it was a growing trend, but I didn't realize it was that widespread. So does this mean we're automatically headed for, like, exploding healthcare costs?
It's easy to assume that, right? But
Yeah.
it's a little more complex than that. Aging plays a part, for sure, but it's not always the biggest factor driving up costs.
Wait, really? That's surprising. Give me an example.
Sure, let's look at the U.S. patent. Research shows that while age does matter, other things like national income and how much medical services cost have an even bigger impact on healthcare spending. So it's not just about the number of older people, it's also about how much money is moving through the system and, well, the prices.
Oh, interesting. So where is aging having a bigger impact on costs then?
Well, in Europe, and kind of surprisingly China, the impact of aging on their healthcare costs is way more noticeable. But even then, it's not that simple. You have to remember that different countries define healthcare costs in different ways. Sometimes studies only look at treatment, and other times they include preventative care or even long-term care. It's like comparing apples and oranges sometimes.
So we need a way to break all that down, right? Like a way to really see what's going on with these costs. Is that where that SHA 2011 framework comes in, the one that was mentioned in the article?
Exactly. You can think of SHA 2011 as a way to track healthcare spending globally. It lets us break things down by age, gender, disease, even by region. That way, we're not just looking at one big number, we can see what's driving costs in different parts of the world.
Okay, that makes sense. I can see how that would be helpful for policymakers, but what does it mean for, the average person?
Well, it helps us see where our healthcare dollars are actually going. Are they being spent on, say, treating chronic diseases in older adults, or on preventative care for younger people? This kind of data helps people make smarter decisions about where to invest resources. It affects us all in the end.
I see, I see. So we've talked about the aging trend and how to track these healthcare costs, but let's talk about the real issue here. How much are we actually talking about when it comes to older adults and healthcare expenses?
Well, the numbers are pretty eye-opening, to say the least. Like in China, for example, their healthcare spending increased more than 10 times, tenfold, between 2000 and 2017. That's like your grocery bill suddenly being 10 times higher overnight.
Oof, that's a lot of yuan. Where is the strain felt most?
Just look at Beijing. They're expecting senior citizens to account for over two-thirds of all healthcare expenses by 2030. And even way back in 1978, in the U.S., per capita healthcare spending for older adults was already over 7 times higher than for younger people.
Wow, yeah, that's a huge burden. I mean, not just for individuals and families, but for the whole healthcare system, right? We definitely can't ignore this.
Yeah.
So, what's actually driving these costs up so high for older adults? The article mentioned a bunch of different factors.
Oh, there are a lot of factors. Social factors, medical factors, even familial ones, all mixed together. It's kind of like a big tangled knot that we need to figure out how to untie.
Okay, well, let's try to untangle it. Where should we start?
Let's start with social factors, like public policies and health insurance systems. They have a huge impact on how much people end up spending on healthcare.
Can you give me an example?
Yeah, so a lot of developed countries really focus on preventative care and community health services. The idea is to, catch health issues early on and manage them within the community so people can avoid those expensive hospital stays later. It's kind of like fixing a small crack in your foundation before it turns into a major problem.
I like that, a good analogy. What's the other side of that coin then?
Well, in contrast, in China, they tend to rely more on large hospitals for senior care. And since hospital care is generally more expensive than community-based care, that can lead to higher costs overall. It's a different approach, and it seems to come with different costs.
Interesting. Okay, what about medical factors? What role are they playing in all of this?
One big one is polypharmacy. Basically, that's when people are taking multiple medications, which is pretty common among older adults who might be managing several chronic conditions. And, it's kind of ironic, but medical advancements, while they're amazing for helping us live longer, can also be driving up costs. I mean, think about it. More complex procedures, more advanced medications, they all come with a pretty hefty price tag. We're living longer, but it's costing us.
It's like we're being kept alive by golden handcuffs. So we've got social factors, we've got medical factors. What about the family aspect? How does that fit into the picture?
Well, family size and the kind of support structures that exist can have a big influence on healthcare costs, especially for older adults. Like in China, it's common to have those large, multi-generational families living together, which often means more family support is available. But that can also mean higher long-term care costs, too.
Because you've got more people involved in the care.
Exactly. And then you contrast that with Western countries, where families tend to be smaller. Older adults there might rely more on formal care systems, like nursing homes and things like that, which can get really expensive. It really shows you how these cultural norms can have a big impact on healthcare costs.
Yeah, absolutely. It's not just about the medicine itself, it's about, well, the whole social structure. But we also have to think about individual factors too, right?
Right. Things like age, gender, education, income, even pre-existing conditions, they all play a role in how much an individual ends up spending on healthcare. And as you might expect, the closer someone is to the end of their life, the higher the costs tend to be.
That's a sensitive topic, but definitely an important one. I mean, how do we balance quality of life with, the cost of care as we get older? Something I think a lot of people are struggling with.
It's a crucial question, and there are no easy answers. But by understanding just how complex this all is, we can start having more informed conversations and figure out how to navigate these challenges.
All right, so this is way more complicated than I initially thought. But before we get too overwhelmed, the article did mention some limitations with the research that's been done so far. What gaps do we need to keep in mind?
One thing they point out is that morbidity might be underestimated in a lot of cases. Since chronic illnesses can last for years, people might not seek medical attention every time they have a flare-up. That means we might not be getting the full picture of how widespread some diseases really are, which can skew our cost estimates.
So, like, we're missing some pieces of the puzzle.
Yeah, exactly. Another issue is that the data might not always be representative. If studies only focus on a specific group of people, their findings might not apply to everyone. Plus, the way costs are calculated can vary a lot, making it hard to compare data from different studies. It's not always a fair comparison.
Right, we have to make sure the data is actually reflecting what's happening in the real world. Anything else to keep in mind?
The most interesting challenge they highlight is the role of what they call irrational factors. Things like drug abuse or just unreasonable pricing practices. Well, those can definitely inflate healthcare costs, but they're really hard to measure and factor into, standardized calculations.
Those are tough issues to tackle. So, how do we even begin to address these irrational factors in a way that's fair and effective?
Yeah, that's the million-dollar question. It requires thinking outside the box and finding creative solutions. And it takes a combined effort involving healthcare providers, policymakers, and even individuals making smart decisions about their own care.
Wow, this is a lot to take in. It's clear that aging and healthcare costs are tangled up in a complex web. Social factors, medical factors, economics, even cultural norms, it all plays a part. And there are no easy answers. But I think understanding the nuances, like we're doing here, is the first step towards asking the right questions and finding solutions that work. We'll be back with part 2 of this deep dive soon to uncover even more about this intricate issue.
So, picking up where we left off, let's dig a little deeper into potential solutions. One thing the article really focused on was the role of medical insurance, how it can help with these rising costs for older adults.
All right, we touched on the different healthcare systems earlier and how they approach insurance, but what does the research actually say about, how effective insurance is at reducing the burden?
Well, the data's pretty clear on this one. Medical insurance has a big impact, like a really substantial impact on lowering medical expenses and just easing the financial strain on seniors in general. Think about it. For people over 65 who have medical security, medical expenses only make up less than 65% of their total out-of-pocket costs.
Wow, that's a big difference. So having insurance really does make a dent in those costs, huh?
Oh yeah, for sure. On average, it can reduce the total medical burden for older adults, both in urban and rural areas, by about 25%. And even more impressive, it can cut the proportion of family out-of-pocket expenses, in total expenses, by more than half.
Those are some pretty convincing numbers. It really sounds like having solid medical insurance coverage could be a key part of the solution here.
It seems that way, yeah. But the article also pointed out that the impact of insurance can be really different depending on the specific system, how it's set up. Like in China, for example, even though their health insurance covers a lot of people, they still have some limitations, and that can lead to, well, some pretty high out-of-pocket expenses for seniors.
Yeah, I get it. It's like having a safety net, but with holes in it. It helps, but you can still fall through.
Exactly. And those out-of-pocket costs can really add up, especially for older adults who might be living on a fixed income.
So it sounds like we need to, I don't know, maybe fine tune these insurance systems a bit, make sure they're really providing that financial protection that people need. What did the article suggest?
They really stress the need for ongoing reforms to medical insurance programs,
Hmm.
especially things that increase reimbursement rates for seniors. I mean, think about it. If your insurance covered a larger portion of your medical bills, that would definitely help.
For sure, it would take a lot of pressure off. Any other recommendations?
Yeah, they also called for more research into the impact of, medical insurance funds and healthcare system reforms. We need to really understand how these systems work, and how they can be tweaked to work better for aging populations.
Like fine tuning a really complex machine.
That's a great way to put it. And along those lines, they suggested developing like these really comprehensive medical insurance reform plans. Plans that are specifically designed for aging populations. It's about being proactive, thinking ahead, and not just reacting to problems as they pop up.
Planning for the future, not just putting out fires.
Exactly. The article really emphasized that policymakers need to be paying close attention to the medical costs that older adults are facing and, all the different things that contribute to those costs. It's about understanding both the big picture and all the little details that make up that picture.
And then using that understanding to create policies that actually address the whole problem.
Exactly. It's not a quick fix, but it's really important for making sure older populations are well taken care of and, frankly, for the long-term health of our healthcare systems.
This has been really eye-opening. We've seen how important medical insurance is, but it's clear there's still work to be done. Before we wrap up this part of our deep dive, are there any limitations with the research we should be aware of, when it comes to medical expenses and aging?
That's a good point. The authors did mention a couple of limitations specific to their review. One thing they pointed out was that their focus was mainly on published research, which means there might be valuable information out there from unpublished studies, or data that they just didn't have access to. It's kind of like reading only part of a book. You might be missing some key chapters.
So there could be more to the story than we're seeing here.
Potentially. Another limitation they acknowledged was that they didn't provide a really detailed breakdown of how they chose which studies to include in their review. They were going for a summary of the most relevant research, but it would be helpful to have more transparency about that selection process. It's like knowing the ingredients that went into a recipe. It helps you understand the final dish better.
So we don't have the full context of all the research that might be out there. But even with those limitations, this article does give us some valuable insights.
Oh, absolutely. It lays a really solid foundation for future research and policy development, and helps pave the way for more effective solutions down the road.
Now let's move on to the final part of our deep dive, where we'll explore some concluding thoughts and, the key takeaways from everything we've discussed.
All right. So as we wrap up our deep dive into all this, medical expenses and aging populations, what are the big takeaways? What should people really remember from all of this?
Well, I think the most important thing to remember is that this isn't a simple issue. There's no easy fix, no one-size-fits-all solution. It's kind of like trying to solve a Rubik's Cube. You can't just focus on one side. You got to consider how all the different pieces fit together. We're talking about demographics, healthcare systems, social factors, even cultural norms. It all interacts to create this really complex situation.
It's all about seeing the big picture, right? Connecting all those dots. Exactly. And it takes everyone working together, too. Researchers, policymakers, healthcare providers, even individuals. We all have a role to play in this.
It's a shared responsibility then. It's
Yeah.
not just something the government or insurance companies need to figure out on their own.
That's right. And as individuals, I think we can really empower ourselves by, making healthy choices, staying informed about our healthcare options, and having those open conversations with our families and doctors.
Those are all great points. It's about being proactive, taking charge of our own health, and not just waiting for things to happen to us, right?
Absolutely. Don't be afraid to ask questions and advocate for yourself. You know what they say, Knowledge is power. Yeah, I want to leave you with one final thought, something to really chew on. We spent a lot of time talking about, the economic burden of aging and how tough it can be to provide quality care.
Mm.
But have we thought about the opportunities?
Opportunities. I gotta be honest, it's hard to see a silver lining here.
Okay, well, think about it this way. People are living longer now. We have this growing population of older adults who are healthier and more active than, older generations in the past. I think this gives us a real chance to redefine what aging means. We can challenge those old stereotypes and build a society that values the contributions of older adults.
So instead of seeing aging as like this decline, we see it as a new chapter, a chance for new things.
Exactly. Imagine what we could do if we really embrace the experience, wisdom, and even, the economic power of this growing demographic. What if, instead of a burden, we saw older adults as, like, this valuable asset?
That's a really powerful shift in perspective. We're not just talking about managing the costs, we're talking about unlocking potential.
That's it. So as you continue to learn about all this, I really want you to think beyond just the challenges and consider those possibilities. How can we create a future where aging is something we embrace, not something we fear? A future where, living longer actually means greater opportunities for both individuals and society as a whole.
That's a fantastic question and a great note to end on. Thanks so much for joining us today and sharing your expertise. This deep dive has been really informative and definitely got me thinking.
My pleasure. I always enjoy these conversations.
And to all our listeners, thanks for coming along on this journey with us. We hope you learned something new, maybe gained a new perspective, and hopefully even sparked some ideas of your own. And remember, the conversation doesn't end here. Keep learning, keep asking questions, and keep diving deep into the things that matter to you. We'll catch you next time on The Deep Dive.